Retired Sioux City Fire Chief is thanking early prevention methods for helping him spot his lung cancer early. KTIV's Taylor Deckard has more on how, if the cancer is caught early, it's easier for doctors to treat the disease using effective and appropriate treatment at the Junine Island Cancer Center.
There's no sure way to prevent lung cancer, but you can reduce your risk and stay on top of symptoms. Dr. Lisa Chaikin, radiation oncologist at Junine Island Cancer Center, sees many patients in different aspects of their care before, during, and after screenings.
Looking for something, typically a little nodule that might be a little irregular, a certain size. It may not be something that's automatically we look at and say that's cancer, but it may be something that patients need to follow or even go for a biopsy fairly soon.
That's what happened to 72-year-old Gary Heath, a retired firefighter for Sioux City, recently diagnosed with early-stage lung cancer, also known as A1 lung cancer.
I'd been having, and there was a calendar on the, I think I need that scan.
They found a spot using a non-invasive scan that gave a better visual of the organ. There are many factors that could lead to lung cancer, smoking being the #1 cause.
I was a smoker. I had quit smoking before this, but I was a smoker for a long time. I grew up on a farm in the 50s. Lots of grain dust, that sort of thing. And then I was a fireman in Sioux City for 32 years. And the first few years I was on the job, we never had SCBAs. We just went in.
Heath's lung cancer was spotted so early it was removed via surgery. But if it had progressed, it would have needed a more aggressive form of treatment.
What is wonderful about it in lung cancer is that we have a low radiation exposure scan, no injections, no drinking any barium. It just takes a quick view of the lungs and it can actually detect very early asymptomatic lung cancers and we think save lives.
If you have any qualms at all that there's something wrong, just get a scan. Because believe me, it's much better earlier than later.
Reporting for Healthbeat 4, Taylor Deckard, KTIV News 4.
20% of patients who get lung cancer are non-smokers. Of that 20%, about 2/3 of them are women. Medical providers want to ensure that all respiratory symptoms need to be taken seriously and look at certain types of screenings for preventative measures of other kinds of cancer. The American Lung Association released its 2023 State of Lung Cancer report last week, detailing progress in lung cancer prevention, screening, and treatment. Lung cancer has long been the leading cause of the cancer related to deaths in Iowa. In Iowa, 7.1% of those at high risk were screened, which was significantly higher than the national rate of 5%. Iowa's 5-year survival rate is only 24.8%, which is deemed significantly lower than the national rate of 26.6%. Also, the early diagnosis rate in Iowa improved by 40%, but only 24.8% of cases are caught at an early stage.